I'm Royce Money, Executive Director of the Siburt Institute for Church Ministry at Abilene Christian University. We're talking today on a follow-up conversation with three gentlemen here that I'll shortly introduce to you about the Affordable Care Act and how it affects ministry staffs and ministry families. John Mulligan is to my right. John is Executive Minister of the Highland Oaks Church of Christ in Dallas, Texas. John, since you're the board chair of Christian Leaders Benefits Alliance, why don't you introduce our other guests and then we'll get into the conversation.
Sure. We have Neil Toffoli from Gallagher Benefit Services. He's a former actuary and a consultant to all kinds of businesses that pursue and purchase healthcare. And then Jim Hamlet is with us from Indianapolis. He's the president of the Disciples of Christ Pension Fund and also responsible for the healthcare plan that many of us get to participate in. So we really appreciate you guys being with us today. Thank you.
Great. John, one way to start would be to give in a review fashion a little bit of the history of how this whole association and our relationship with these guys started, and then we'll start where it is today, and then we'll begin to compare where we are today with the pluses and minuses of what is available through the Affordable Care Act.
Well, Charlie Siburt, as you know, had a dream to find a way for ministers who are either in the hinterlands of ministry out in rural areas or in urban areas to coagulate, work together to buy health care because it just makes sense. It's economically better. And so we looked high and low and eventually came upon Jim and his group, which is the Disciples of Christ. They have a pension fund and this health care plan that they were welcoming us to all along, and we just weren't really paying attention. And so we began to work with them and began to market that with the help of Gallagher alongside of us because they're the experts in healthcare. And about 6-7 years ago, we launched the plan into January of one of those years, 07, 06, I can't remember exactly. And so since then, we've been gathering more and more people to it because it does make sense. The rates are excellent and very helpful. The plans make a lot of sense to us as ministers, and you can be an individual and get into the plan with very few questions asked, or you can be a group and enter into the plan. And so we've been doing it now for 6 or 7 years. The rate increases have been very low compared to the marketplace. And with Gallagher alongside of us, they've been coaching us on how to, make sure that we're doing, dotting the I's and crossing the T's on our side. So Charlie was thrilled that we got to do it. I'm obviously thrilled. I'm a participant in the plan. Highland Oaks participates. Other large churches do across the country. It's nationwide. So it's very robust. It's very holistic and comprehensive. And so we formed CLBA then to be the marketing arm. All we do with CLBA is simply inform people about benefits, but we do point them to the Disciples of Christ plan more than others because it's a good one.
Jim, how many people approximately in Churches of Christ are covered in the current health care plan?
Today we have almost 500 employee lives, and we're delighted to have that opportunity to serve throughout that communion.
Well, it makes a lot of sense in Stone Campbell Restoration tradition for us, all of us, to be involved, and I think it's very helpful. Now, we were talking in August about something that was to go into effect January 1st, and that's the Affordable Care Act. And it's really interesting to reflect on what we were talking about then. There was quite a bit of interest from ministry families. Now, here we are at the end of March 2014, almost wrapping up 3 months, and the enrollment period is closing soon. I would be interested from you two guys, what do you see that's happened? What do we know now that we didn't know last August?
Well, I think first off, we know that most of the exchanges are still not ready to run, and that has delayed a lot of participation. Current estimates are they still expect up to 6 million people to sign on by the end of March. That's a number that's subject to a lot of discussion, I'm sure. But it has slowed the process tremendously, and there's still great confusion about the Affordable Care Act and what plans are available.
Okay. Neil, you're seeing the same thing?
Absolutely. It's been I think it got off on a bumpy road. I don't think the exchanges were quite ready to handle the enrollment process. It's a very cumbersome process. There's been a lot of press, obviously, about that. I don't think they were ready at the time. We've heard, today there's, a couple of million people on that, on the exchanges, on the public exchanges, and I think what a lot of people don't realize is a lot of Medicaid people are on the exchange versus commercial type, individuals that are out in that have options. So those Medicaid people transferred over to the exchange from the government. So actually how many people are on that exchange? There's a lot of different numbers that have been published. No one really knows. It looks like they're extending that enrollment for individuals that need additional time. It's a moving target. It's a lot of regulations to come.
One of the things we talked about, John, when you and I were on that panel in August, had to do with whether it would be better for a ministry staff of 3 or 4 or 10 or private Christian school staff of 20 or 25 or 30, where it'd be better for them to stick with this plan through Disciples of Christ, the Blue Cross Blue Shield plan, group plan, individual plan, or whether it would be better to go on the market, to go on the exchange. And so what has changed, in your opinion, John, in this intervening time?
Well, one of the things that's always interesting is, you may have, if you have a plan, you know what it is. So now you go to compare, and when you go to compare, do you know what you're comparing it to? Because you're certainly not going to get an apples and apples comparison, because your plan is probably unique. So how do you know how to move over to another plan? And then when you're somebody like me who's responsible for a group of people, you feel even more responsibility to check all the details, and so it gets a bit scary. And so one of the things I appreciate about what we've been doing over 5 years is we've had this plan. It is known, and it's worked for us. And I know we had a few people leave us at the break. We weren't sure how many people might go over to the exchange and go search for a better deal. Some did. Some went and searched and felt like they found one and left us, but it was a very small number. And one of the things we were talking about, you and I, earlier, was one of the reasons they might think twice about leaving what we have, which is a Blue Cross Blue Shield Highmark network that's pretty solid and known, versus some of these other plans that might look cheaper but have a very restricted pool of people and places that they could go to get service, right?
Oh, very clearly. On the exchange, one of the ways that the exchanges and the exchange policies help cut cost is by restricting the number of hospitals and physicians that are in their network. And one might find, if you're in an exchange plan, you might have to drive 50 or 100 miles to get to the specialist that's in the network. And in the plans that we offer, we've still maintained a very robust network that covers about 99% of physicians and hospitals throughout the country. It's a very, very robust network, and makes it easier for people to choose not only their clinicians, but to get to a hospital when they need to.
And it really doesn't matter on this plan where you live.
Does not.
I mean,
It's national coverage.
Yeah.
It is national
Every
coverage.
Blues network is the largest network that's available, the PPO network that you have. And I think testament to what Jim said is your network utilization. When we look back and look to see what providers are being utilized, 98% of all the services that have been delivered through the program have been from in-network providers.
In-network
providers.
That's big.
Right.
Jim, you were mentioning earlier a city in the U.S. that had something like 4 rather large hospital complexes, but only one of the 4 would take the Affordable Care Act participants. Is that, did I understand you correctly?
Oh, it actually was the insurance provider that selected only one of the 4 health networks in that city as in-network, and the other 3 were excluded.
Yeah.
Which meant that 3/4 of the doctors and hospital folks are no longer available to those participants. And that's really not true with the plans that we have. And one of the reasons that we got into the health insurance program to begin with was to help pastors who would move from one state to another to have consistency of health coverage. And if you were going to an exchange, you would have that same issue today. You would have to go from one exchange into another state exchange. And so having the consistency of portability, if you will.
Okay, so if you leave
That's
Texas, if you leave
Yeah.
Texas and go Alabama or
Yeah.
somewhere, and you have to,
You would have to enroll in new health insurance coverage on a new exchange in that new state.
okay,
But with our plan, if you
The
move,
coverage would be
it's
portable.
completely portable.
Exactly right.
Yeah, whether you move from a small church to a large, or large to small, or north or south.
Exactly right.
so
It's
in
gonna
that
be
sense,
covered.
you carry the insurance with you.
Yeah, that's huge.
Wherever you go. And so, what else have the two of you seen from a professional standpoint here that have been stick points or points of controversy or points that still have to be worked out? I think of one, the prescription drug situation you were talking about. There's a lot happening there, and so when you're examining a plan, it's not just the doctors, it's the whole package, is it not?
Exactly right. And depending upon if you are going into an exchange, both the doctor and the pharmacy will be subject to different deductibles, different plan designs, depending upon the level that you choose. And if you go to the bronze plan, it will be a very sparse plan, both doctor, hospital, and pharmacy. We've got much more expensive. Pay less in your insurance coverage, but more out of pocket.
Okay.
And I think from a pricing standpoint, and looking at what the cost for the program that we deliver through the CLVA program and the Disciples of Christ and the Christian Fund, there's a lot of unknown risks on the exchanges today because no one really knows. The insurance companies backing the exchanges, they don't know what risk is going to come onto that plan. And when they don't know the risk, they're going to be conservative when you look at what things cost. So I think it's what we offer today is very competitive. The selection is very solid. It's very rich. The $500 deductible plan is a very rich program in today's marketplace from an offering standpoint at affordable prices.
Yeah. And there are tiers, and it's starting to sound like a commercial for the plan. The fact is, it's good. I mean, it's very helpful.
I'll just be real clear, John. We at the Siburt Institute are interested in what benefits ministry families the most. And so we want to be very practical here and very direct and give people who see this video some information on which to base their decisions. This is really a confusing thing to speak for all the folks out there.
Yeah.
It's really confusing
It is.
unless you're an expert in the field. And so I'm trying to help our ministers to understand just a little bit about the pluses and minuses and whether they're comparing apples and apples or
Right.
apples and oranges.
Yeah.
And so anything that we can do on this video to make that clearer, I am not beyond promotion.
Absolutely.
Because we have their welfare in mind, and that's really important.
Yeah, and the thing I would want to, the reason I said that is because it does sound like that, but the fact is, what we have, the people that participate in this plan have, is quite a bit more certainty in a very, very uncertain environment. Now, that certainty isn't forevermore. We know that the laws can change and different things are going on in Congress. You talked about that. You've got a lobby group that's trying to create a church exchange, if
Right.
that's what's necessary. But even talking about that could be confusing. The fact is, right now, we know that 14 is solid. We believe 15 is probably going to continue. We'll be able to stay the way it is for now,
Right.
as best we know. 16 is
Unknown.
right? And I think that's important. But it's more known to me and to us that are on the plan than it is for some.
Right.
And it's a known quantity that is available to ministers in particular, whether you're a single minister in a faraway place or in an urban setting with a large church.
Okay.
Your church can participate.
Yeah. And I think what's, from my perspective, what's important to know is that the Pension Fund of the Christian Church shares the Siburt Institute interest in the health and well-being of pastors. We were created in 1895 to support the ministry, whether it is in the Disciples of Christ or in the Church of Christ, throughout the Restoration Movement. We were created to support the ministry. This is one of those programs that we do for that purpose.
Yeah.
Jim and Neil, let me ask the two of you, if you're a typical ministry family out there and you're trying to assess your healthcare needs, what basic things you need to look for as you examine this variety now that's on the marketplace?
Well, I think if you're a very small congregation, single pastor, for example, or pastor and secretary, you may want to take a look at the Affordable Care Act, particularly because of the subsidies that are available. For a pastor and the housing allowance, which comes off of taxable insurance, it may qualify for more of a subsidy and give you an opportunity to buy better coverage at lower cost.
Right.
You may want to look at ours as well, but you would probably want to look at the Affordable Care Act. If you are a large congregation, one that has 20 or 30 people on staff, you probably want to stay at an employer-based coverage. Whether you go into the market or you look to us, an employer-based coverage and not the Affordable Care Act per se. And when you get into in between, then you have several options. The congregation, if it's small enough, under 20 employees, could qualify for subsidy on its own. And buy the health insurance through the appropriate vehicles and then qualify for subsidy to help pay for that. Or they could encourage people to go to the Affordable Care Act, or then they could look to us or other commercial.
Okay.
There are several options, but you ought to weigh the costs and the benefits of each plan and how it affects the people who are going to be covered.
And we mentioned earlier that that's not always easy to do, and because I'm not that they're the hidden costs as much as unexpected or unanticipated consequences. Neil, that's more in your area, but how do you see what typically ministers should look at in trying to make these choices?
Yeah, it's a great question. So benefits are available through three primary sources now, through distribution channels. So whether it's you can go direct to an insurance company and get a policy, you can go to an exchange, the public exchange, now they're calling the public exchange the marketplace, or you can get it through your employer if it's offered through your employer. I think you have to look at the costs and the benefits of the program, but I think it's incumbent upon every individual to really look at what options are available. They need to explore all options, and I think this is one of the options that should be explored.
Yeah, and just to look at a premium price is really not enough.
No.
Right, you need to be looking at what the deductibles are, you need to look at what the prescription benefit is.
benefits
We haven't talked
Absolutely.
much about the prescription benefit yet, but that can also be a pretty complex thing, can it not?
Very much so. Depending upon what the plan covers, it may have high deductibles, it may have much higher co-pays versus a different plan. You really have to look at what in your own health situation, where do you spend money and how does that apply to the benefits that are there?
Do they have to go so far as to look at formularies and what drugs are offered? Has that gone away a bit?
It often is helpful to do that.
There may be
It's very
drugs of exclusion or,
Yeah.
Right.
or specialty
Sometimes-
drugs or something of that sort.
Sometimes the lower cost plans will have a tighter formulary, and you might be on a prescription of brand name drug that's not covered under that formulary. You might be paying a lot more out of pocket. So I do think it's getting to that level of detail. You have to take the time
So
and look at those
check
things.
whether you can continue with your present physicians and even with your present medication and be covered by
Exactly right.
various plans.
It's probably likely that the Affordable Care Act has actually helped, and we've talked about this before, helped some folks, and it's going to be helpful to some situations where it's almost like a lifesaver for them when it comes to their
Absolutely.
care.
It's certainly true for those who have pre-existing condition.
Right.
Or older children, if you will, of families up to age 26. But those with pre-existing condition, this is really a godsend.
Well, it was mentioned that the CLBA and Charlie being the founder effectively was interested only in informing people of where they could go for some of these different benefits. It's not just healthcare. Right? We could point them to pension plans. We can point them to other ways, other benefits that are available to them. We're simply an information group. But one of the places we have found that's really helpful is the Disciples of Christ health.
And we're grateful that we have this opportunity, and it's just been a pleasure to be partners with you, and we appreciate your leadership, Jim, and Neil. Gallagher Services has really been very helpful to us. John, thank you also for your service on the CLBA board. And at the end of this video, we're going to put some contact information. that you can follow up with. It occurred to me also that there may be some elder groups out there, administrative elders, or whoever, that perhaps need to see this video. We'll be glad to talk to you as well. And we hope that you're taking really good care of those on your ministry staff, because they're the Lord's servants, and that's what we exist for, and that's who we're looking out for, and we know you are too. Thank you.